Good day and welcome everybody. So sit back, soak in the shared information, stir your noggins and ask yourself a few questions and see how you can develop some relatable insights here with these great presentations today. So I'll get started with the fun poster stuff. I have the privilege of introducing our first presenter, Lindsay Clark. She's a registered nurse and program manager of design and improvement at SickKids. And to best understand and solve healthcare problems, Lindsay does four things. She uses human-centered design, strategic foresight, system thinking, and then designs strategic research methods. And in alignment with strategic design, Lindsay's poster presentation for today is titled Building Vaccine Confidence in Children and Youth, an evaluation of nurse-led provincial vaccine consult service. So welcome, Lindsay. You're first out of the gate, so we're all ears and excited to hear from you. Take it away.
Great, thank you so much. I'm really pleased to be here presenting on behalf of a big team effort in terms of launching and implementing the SickKids COVID-19 vaccine consult service. So in the early summer last year, we really saw that the youth vaccination rates here in Ontario began to plateau. It was coupled at the same time with the myocarditis safety signal really hitting the media. And it became clear that we needed that youth, parents, and caregivers in the province really needed access to reliable information to be able to move forward with an informed decision about vaccination. So this is really how the service was born. We spent some time thinking about our model, and we launched our service in October 2021. So we are a provincially funded program, and our goal really is to provide Ontarians with access to a safe, judgment-free space to have an open conversation. Whether that's about specific questions or concerns related to the COVID-19 vaccine for youth and children. They may not be able to find the answers to elsewhere. We also support families whose children have complex medical histories or medical conditions with a decision about vaccination. And we also help families book vaccines. So whether their child may require additional support for their vaccination, where a mass immunization clinic or other community clinic might not be the right place for them and they need a bit more specialized support. So when we were developing our model, we had a lot of discussions about whether we should adopt a hotline approach or an appointment-based model. But what we knew is we wanted to be able to provide access to the service as soon as possible once the person decided they were ready to have a conversation. But we also wanted to have enough time to really develop the rapport that's needed to be able to have these conversations. We didn't want the families to feel rushed. We also didn't want to lose people on hold while they waited to talk to a member of our team. And I also want to give credit. We also learned from our colleagues at Scarborough Health Network in their VaxFax service. They were very generous with sharing with us what had been successful with the adult population. So in the end, we launched an appointment-based service where families can book directly on our website or they can call our team toll-free. And this is one of the features that families point out most often to us is really helpful, having that dedicated time set aside for this conversation. At the time of the appointment, one of our nurses calls the family. The RNs use motivational interviewing, which we've heard about earlier today. And the calls are really focused on listening and validating concerns and then providing objective evidence. We do have an escalation model in place. So for individuals who have persistent hesitancy, or if they're seeking really individualized medical guidance, we can escalate that call for the family. So as of today, we looked at our data. We've seen nearly 1,200 appointments, or we've had nearly 1,200 appointments with families in Ontario. And as you can see on the poster, the top 5 reasons for calling the service have really remained consistent since our launch in October. Although recently we've seen more questions related to dosing intervals for the 5 to 11, and also related to timing after COVID-19 infection. The data that comes out of our service really drives our living FAQ that's on our health literacy website called About Kids Health. And we keep that up to date each week with the data that's coming out of the consult service. We are actively working to be able to ensure that we can really reach all parts of the province. You can see from our location data, we're really focused on the Greater Toronto area. So this is the next phase, is really understanding how we can take our service to the community instead of waiting for people to come to us. Thank you.
Great presentation, Lindsay. Thanks. I have a quick question for you. I realize it's a challenge for many of our healthcare professionals to wrap their head around where concerned and hesitant families are coming from. Would you be able to provide us with some advice on how healthcare professionals could best have a conversation with families who have concerns about COVID-19 vaccines?
Sure. I mean, I think I'm following two great presentations. I wasn't able to catch all of them, but I think you've already heard a lot of really great techniques in terms of how to have these conversations. As I mentioned, we use motivational interviewing as sort of the main technique that our nurses are trained in and how they have these conversations. I think I heard Cora say earlier, I think that that positive interaction is so important in really setting that environment for people to be able to ask their question, really talk about their concerns and that validation piece to tell them that no matter what their concern is, it is a valid concern. And especially when you're talking with a parent, letting them know that they've done the right thing by asking the questions, by having the concern. Of course, they would want to protect their child and make the absolute best decision for their child. So really letting them know that they are doing the right thing by asking the question. And then I think it's really important that if you don't know the answer, and this happens to our nurses also, where we actually don't have the facts right at our fingertips sometimes, we don't have the latest stats. So we are going to go back to that family. We're going to tell them we don't know the answer. We're going to go away, do our research, come back, or escalate the appointment appropriately.
Thank you. We'll be moving on to our next presenter. So I would like to present to you Sonia Hisyung, and she is the project lead for communications and stakeholder relations at the Alliance for Healthier Communities. She's been very diligent lending cross-sector support to the COVID-19 response, from testing, health promotion and wraparound supports, health human resources to vaccination. Her current professional contributions involve managing the community vaccination promotion, which is an Ontario project and is funded by PHAC Immunization Partnership Fund, which of course is the Public Health Agency of Canada. Sonia today will be presenting on equity, community, and trust, building vaccine confidence with marginalized populations. So welcome, Sonia. I'll now hand the reins on to you with the hopes that you can influence our national colleagues on how to best help our marginalized populations.
Thank you for that introduction, and thank you for this opportunity to share about our work. So to give you some context, Alliance is a member network of team-based comprehensive primary healthcare organizations across Ontario, and that includes community health centers, nurse practitioner-led clinics, Aboriginal health centers, and community family health teams. Our members work from a health equity framework and the model of health and well-being. They are focused on providing holistic healthcare that is community-led, anti-oppressive, and culturally appropriate, and they take into account the social determinants of health. The COVID-19 pandemic has really highlighted deep-rooted social and health inequities. Racialized and lower income communities were hardest hit by COVID-19, yet if we overlaid a map of COVID-19 infections and a map of COVID-19 vaccinations, we see that they're almost inverse, where areas that bore the highest disease burden from the pandemic are also areas with the lowest vaccine uptake. So the data really underscores how challenging it can be for populations that experience systemic and historical barriers to access the necessary health information and services. And COVID-19 vaccinations is no exception. So in this context, we can't expect one-size-fits-all solutions to work. It's probably a bit hard to read on the poster, but in a wide variety of settings, the varied initiatives include uncovering the barriers and needs of the community through some focus groups, asking them where they get their information from, how do they communicate, where are their trusted sources, responding by intentional door-to-door outreach with community ambassadors who reflect the linguistic and ethnic backgrounds of the population, providing logistical support such as booking and transportation, and partnering with public transportation authorities, schools, faith leaders, and cultural spaces to share information and provide vaccination in familiar spaces that is perceived to be safe, or holding town halls to address misinformation and answering questions in a variety of languages and providing live interpretation in physician offices and vaccine clinics. So all of these tailored approaches have been very successful. The poster includes our numbers from September, but in the last week, we were able to collate our data up to the end of December, and where we saw 85 online and in-person public events were held, And over 16,000 individuals and families were reached through these events, as well as phone calls, WhatsApp messages, door-to-door visits, and other very individualized outreach. And over 200,000 people were reached indirectly through social media and local newspapers and community radio advertisements. And we can count more than 13,000 individuals who agreed to vaccinate. So we see that these hyper-local strategies work in reaching that last mile group. They build on a relationship of trust to be able to share accurate information via linguistically and culturally appropriate forums with specific populations who may not have received or trusted the information otherwise. So the lessons we have learned have ramifications beyond the current pandemic. Health system leadership will play a key role in ensuring that the strides we've made in building trust are sustained to emerge from COVID-19 equitably and to address other health needs and future crises, including the expected massive backlog in cancer screening, chronic disease, declines in mental health. We have to build on the powering community. Thank you for your time.
Hi, Sonia. You've done a good job of conveying the importance of addressing our marginalized populations. Just wondering, from a health systems leadership perspective, what tools or approaches do you suggest using to help professionals who've perhaps always resided in the privileged bubble, if I can call it that, so that they can become more comfortable, take the time, engage, and explore the needs and spaces of marginalized populations?
That is a great question. I think partnership with communities that are doing this work, communities and organizations that are engaged in this work is very important. So there's, for example, an Ontario Black Physicians Association and other like the Southeast Asian Vaccine Task Force. So learning from these organizations that are doing the work is important. And of course, recognizing and having awareness of why the communities have these histories of distrust and barriers is, of course, the first step.
Thank you very much. And with that great ending, we'll move on to the next presenter. So I'd like to present to you Dr. Catherine Kelly. Some of you may know her as Katie, according to my notes. So she's a postdoctoral fellow in health-centered research in the Health-Centered Research Clinic at the University of Prince Edward Island. She holds a PhD in interdisciplinary studies from the University of New Brunswick, some of my old stomping grounds. Anyway, her research interests include patient navigation, health services research, and social media-based peer support. And currently she leads the development and implementation of a province-wide immunization support program, specific, of course, to COVID-19 within Prince Edward Island. And so relatedly speaking, today, Dr. Kelly will be taking us through a review of the development and implementation of the Island Vaccine Program. So it's a pleasure to have you here today, Dr. Kelly. I'll hand it over to you to shine some light on this.
Thank you very much. Hello. So I'm here today presenting on behalf of my colleagues from the University of Prince Edward Island and our community partners. This poster provides an overview of an ongoing project that aims to provide informational, emotional, and structural support about immunization, and especially the COVID-19 vaccine to residents of PEI. Through a partnership between the UPEI Health-Centered Research Clinic and Chances, a charitable organization that supports families in the province, we aim to build the Island Vaccine Support Program that will be delivered through a broad range of Chances programming to children and their families. This research begins with a thorough review of the literature with two main outputs. The first is to complete a scoping review of programs that provide information about immunization, and the second, a literature review on factors of vaccine hesitancy. The scoping review will be used to identify, characterize, and map the existing knowledge about immunization programs that directly provide information about vaccines to Canadians, and barriers and facilitators to the delivery of identified programs. Findings from this review will inform the development of our program. The second output consists of a literature review on factors of vaccine hesitancy. These factors will be used to assist us in developing a province-wide survey to determine the attitudes and barriers towards immunization programs, and especially the COVID-19 vaccine among residents of PEI. The province-wide survey will allow us to better understand the hesitancies of Islanders to getting immunized or immunizing their children. More specifically, the survey will provide the research team with essential information about residents' attitudes and beliefs on immunization programs, which will be used to tailor the materials provided through our support program. The survey will draw upon validated surveys and will be widely disseminated through our community partners in an online format in multiple languages. In addition to the survey, we will hold focus groups with Islanders to further understand the concerns, attitudes, and beliefs about immunization from various cohorts within the province. The survey and focus groups will inform our research team about the gaps in informational, emotional, and structural support needs to immunization, from which we intend to build the Island Vaccine Support Program. The third objective of our research is to develop this program. The evidence-based materials that will be delivered through this program will derive from several sources and be transcribed to a plain language format that includes basic concepts related to COVID-19 and to disease prevention, transmission, and immunization. This information will be based on peer-reviewed research, as well as from resources validated by the Chief Public Health Office, the World Health Organization, and the US Center for Disease Control, among others. Each of these organizations has provided considerable documentation that enables our program to engage individuals at an appropriate level of literacy. Materials will be delivered through the program offerings of our community partners directly through tailored and individualized interaction with families. We expect that we can enhance the health literacy of individuals through this approach to knowledge translation while addressing identified barriers to COVID-19 vaccination. All participants to the program will complete an attendance sheet and a brief program evaluation survey at the end of each session, and this data will be compiled and used to evaluate the impact of our program. In the fourth and final stage of this project, we plan to arrange with the CPHO and Health PEI to provide COVID-19 vaccination, including booster shots, to participants in the program through satellite clinics. In doing so, we will provide increased access to vaccination for families that are currently struggling with accessibility issues or who have given up in trying to access the COVID-19 vaccine for a variety of reasons. Our program intends to provide essential information to increase the health literacy of Islanders and reduce barriers to immunization. Our program will provide a transferable curriculum that explicitly addresses specific concerns related to the uptake of the COVID-19 vaccine across cohorts, not limited to the province of PEI. Thank you.
Thanks, Kate. Just listening to you, I was wondering, it's difficult identifying and figuring out sometimes how to connect with vaccine concerned families and be able to, find out where they are. And just wondering, considering the high level of vaccination uptake numbers in PEI, how do you plan on ensuring that you reach those individuals so they can be included in your survey?
Yes, so in PEI, we have quite a high level of percentage of individuals, specifically 96.1, who have received their first shot of those over the age of 12. The phase 2 of our project, where we will be doing the province-wide survey and focus groups, we will be we are currently working with a committee consisting of various partners. So we partner with a number of community organizations across the province, including Chances, a number of others, including BIPOC Australia and the Family Resource Center. And we hope to get responses on that large continuum of individuals who are vaccine resistant through to vaccine confident and hesitant in between, to get a better understanding from a research perspective of some of those factors of vaccine hesitancy. So it'll really be through the dissemination of that survey, which will be key.
Well, thank you very much for your insights and for your presentation.
Thank you.
We'll now move on to the next presenter, Sarah Luemba. Bonjour, Sarah, bienvenue. She is the Solution for Kids in Pain SCIP Francophone Hub Knowledge Broker. She's based at the CHU, which is the Centre Hospitalier Universitaire. In English, that's the University Hospital Center, where she is stationed at the Saint Justine Hospital in Montreal. Sarah joined SCIP and was a great compliment to the team, given that she has extensive background in community outreach, as well as her diverse experience working with youth. She is currently completing her master's degree in international development management and has plans to perhaps dedicate her career into global health. Sarah's presentation today is titled "To-Do: Providing French-Speaking Canadian Families with Adequate Tools and Resources on Vaccination for Their Children in the Context of a Pandemic." So Sarah, I invite you now to take over the stage and share with us how you secured equitable access and service to your Francophone communities.
Awesome. Well, hello, everyone, and thank you, Sean, for that introduction. And I am very pleased to be here with you all today. So today I will present on behalf of the Saint-Justin's To-Do team, our poster, as mentioned earlier, titled To-Do, Providing French-Speaking Canadian Families with Adequate Tools and Resources on Vaccination for Their Children in a Context of a Pandemic. With the ongoing COVID-19 pandemic, distribution of vaccination resources and tools is becoming more important than ever to help protect the population. The demands from the healthcare network and families are becoming more urgent, and it is noticed that resources for procedural pain and distress management are not as seemingly abundant and diverse for French-speaking knowledge users. Through the partnership the CHU Saint-Justin has with the organization SKIP, Solutions for Kids in Pain, as they are the regional center for the Francophone Hub, the Institutional Quality Improvement Initiative, To-Do, has the objective to further improve the access to tools and resources on pain and distress management related to procedures, such as vaccination, for all pediatric French-speaking children and healthcare providers. For our methods, constituted of a multidisciplinary team formed of various healthcare providers, such as doctors, nurses, patient partners, nursing advisors, communication advisor, a knowledge broker, and a certified child life specialist, To-Do's team is working together to improve the pain and distress management strategies within all departments and clinics of our hospital. Notably, To-Do developed several Francophone tools and resources to help families, patients, and healthcare providers to better prepare on how to manage and prevent the procedural pain and distress that may occur prior and during vaccination. As a result, in summer 2021, last year, To-Do established to develop a web page with French-written resources for parents of healthcare providers. To-Do also decided to produce and promote through social media specific, concise, and accessible tools dedicated to vaccination. This included an infographic handout, as well as 2 educational videos in French intended for children and for families, one of them being specifically made for children and the other one for their parents. Moreover, an e-learning module was created to help healthcare providers improve their practice of pain and distress management during vaccination. In conclusion, following the recent development of tools and resources for French-speaking Canadian children, families, and healthcare providers, the next step will be to ensure their optimal diffusion and dissemination through the ongoing vaccination campaign. To-Do's leaders plan to contact the Quebec's Ministry of Health and Social Services to possibly collaborate on an effective knowledge transmission partnership. Thank you everyone for listening, and feel free to visit our website to learn more about our activities by scanning the QR code on our poster.
So thank you very much, Sarah. Quick question for you. In addition to our two official languages, Montreal, like many other metropolitan cities across Canada, does serve a number of other multilingual communities, and it's sometimes hard to reach out to all of them. I was just wondering if you identified opportunities through this experience on how we could internally within the organization or in partnership with maybe community organizations, how we can actually spread this further to meet all the needs of our populations, including perhaps the ones that Sonia referred to, which are more vulnerable.
Yes, definitely. So we are actually currently working with, our To-Do leaders are currently working with the Ministry of Health of Social Services. In the last few weeks, they had a few discussions to meet actually with the ministry and the representative to try to reach out to as many populations as we can. At first to our Francophone communities, but also afterwards to all the different communities that we find in our country. We would like to potentially implement a system put into place to improve and increase the diffusion of needle pain and anxiety resources intended for children, families, and caregivers. And thus, we would ideally diffuse specifically that system at the moment that the vaccination appointment is booked. The implementation of that automated system will improve the distribution and dissemination of necessary tools and resources for children, youth, and their caregivers. And we also intend through that to also help us detect and track the potential children and youth that may have a needle phobia and who could benefit from a more specific and intensive support and aid strategy.
Okay, thank you very much, Sarah. Very informational. Appreciate you taking the time today.
Thank you.
We'll move on to our next presenter, Kathy Reed. So Kathy is a registered nurse with 37 years of pediatric experience, including 12 as a nurse practitioner in chronic pain. My colleagues and myself had the privilege of working with her for many years as a mentor to all of us. She currently supports research at the University of Alberta. She has a BSCN from Queen's University, a Master's of Nursing from the University of Alberta, and has worked with ECHO to develop an ebook titled Learning to Live with Chronic Pain, One Family Story. And she is now on the team as a research coordinator developing KT tools for families. Associated with the latter, Kathy is going to present on reducing child head needle poke distress and pain, development and evaluation of novel KT tools for parents. So it's nice to see you again, Kathy. And as per historical practice, funny how history repeats itself, I'm going to hand the ship over to you for knowledge translation and learning.
Thanks so much, Sean, and thanks everyone for inviting us. We're thrilled to be presenting our poster here today, and I'm just here representing the two teams, the ARCH and the ECHO team, and I just would like to respectfully acknowledge that we are located on Treaty 6 territory of the University of Alberta. So I'm going to present some research that was completed before I came on the program, but certainly I was involved with it, that's looking at how we developed two unique knowledge translation tools to target parents so that they could be better partners in health, inform their decision-making, shape treatment expectations, and influence their healthcare utilization surrounding needle pain. We know how distressing it is for the kids and for their parents to see their children have needle pain, especially if it's not managed well. So it's really important that we engage them in managing their child's pain. Our team uses a unique user-centered design that engages stakeholders through multiple different ways to help make sure that we develop a tool for people with people. So for the needle pain KT tools, we completed a systematic review of the parents' experiences and the information needs surrounding needle pain. We then conducted semi-structured interviews with 12 parents of children who were seeking care at the Stollery Children's Hospital Emergency Department, whose child had experienced pain from a needle poke. We then developed the prototypes. We took those prototypes of the infographic and the video to healthcare professionals and to our parent advisory group, who then provided us feedback on those. The final tools that you can see here, if you scan the QR code, a 3-minute video and a short interactive infographic, which integrate the best evidence on how parents can help mitigate their child's pain and distress. We then took the tools back to parents recruited from 5 emergency departments across Canada in urban, rural, and remote locations. We had 73 parents do usability testing on the tools. The usability survey contained 9 questions on the 5-point Likert scale, and you can see those questions that are there on the poster. We found that the parents overall really enjoyed the tools. As you can see the numbers out of the 5s. We have a lot of 4s. We then also took them back to health experts. And I think that's probably where I saw it first as a health expert, was evaluating the tools. 146 health experts looked at the tools as well as our parent advisors and provided feedback. Once we got all of this feedback from parents, we then finally refined the tools. So the video went from being 4 minutes down to 3 minutes. In the infographic, we changed some of the graphics to make it more user-friendly for families to be able to use it. So overall, our results have suggested that the interactive infographic and the whiteboard animation video we developed are useful KT tools for parents. But more importantly, the model that we are using, that you can see in the circle, is a model that involves families and parents throughout the whole process. And this is very unique for development, evaluation, and dissemination of KT tools. Thank you.
Thank you very much, Kathy. You spoke quite clearly on the value of stakeholder theory, where it's really important to involve those that are directly impacted by what we do from day to day. Just wondering, many embrace the patient family-centered care concept within stakeholder approach, and it's often done as the known right thing to do, but sometimes we actually don't necessarily always understand the impact that has. I was wondering if maybe you could share some feedback on how the parents that you engaged actually changed the final product that you were able to come to.
Certainly. So the parents actually helped direct the content from the very beginning, telling us what it was that they needed, what were their information needs. But then they looked at the video, for example, and they said that some of those characters just didn't seem to be realistic to them. So then we went back to the artists and changed the characters. The other thing that we did was the infographic was kind of more app-based, and people had to page through it, but by putting it more web-based, where people could then quickly go to the section that they wanted, because they didn't necessarily want to see everything that was in the infographic. So that's how we engage parents to say, what works well for you?
Great, thanks a lot for your presentation. We're going to move forward now to some more generalized questions from the guests who are on board. Before we move forward to popping in questions, I know that there was one that was placed in the chat box here, and it is for Dr. Catherine Kelly. I was wondering what scoping methodology are you using to collect data information on immunization programs across Canada?
Yeah, thank you. So we're following the Joanna Briggs JBI Institute methodology for scoping reviews. So we've been working with a research librarian to develop a very comprehensive search across the academic and non-academic databases, or so-called gray literature. And we're specifically in this review looking at programs that provide information beyond consent forms or referral to an online source, but rather that direct provision of information. And so putting parameters around that, we're finding a lot of those programs tend to be described more in non-academic databases so far. So we're really trying to create a very thorough, cast a really wide net across those sources.
Okay, thank you very much. I'm going to throw another question in for Lindsay Clark. Lindsay, I did note that you had identified the top 5 concerns. I was wondering if you had any insight from the work that you've done on the ones that were more challenging to not convert, but actually create understanding with among the families that were troubled or having trouble sort of figuring it out.
I think the myocarditis, pericarditis discussion has been difficult because the data is ever evolving. And so we don't have really concrete answers to give to families. And that's sometimes what they're looking for. So they want us to tell them the exact risk, the exact stat for their child at that specific age. And we're just not able to give them that concrete response. So I think, again, it's validating the concern, but sort of having that risk benefit discussion with them so that to help them understand that, you know, there's also a risk, in fact, a greater risk of myocarditis should that child contract COVID-19. And so it's really helping them understand that they have to make the decision with the best available information we have today and for their child, and understanding the specific risk benefit for their child.
Thank you very much. Before I move to the next question, is there a hand from the audience that wants to poke in here? And I'll screen through the 5 screens quickly. You can use your cursor on the bottom with regards to reactions to elicit my awareness. And I'll skip back through one more time. If there isn't any, I'll jump ahead. No worries, I'll give you time to think. No, okay. I did have a question for Sonia. Sonia, in some of the recent research I had done on dynamic workplaces within healthcare, it was important to ensure that we understood the scope of all the communities that we service. But additionally, there's some research that supports actually ensuring that your public healthcare workforce represents in kind the communities that we service. And I was wondering if there was any insight or conversation around how we engage those communities through efforts such as yours by also adding a layer of seated interest to engage them in the consideration of a healthcare career down the line, so that we do have a more formidable workforce that represents the people that we service?
That's a great question. I'm not sure I have all the answer to that, but what throughout the pandemic and even before, what a lot of our community health centers have done is they have hired from the community. So they have trained volunteers, they have hired community ambassadors, they have paid them where possible, and they've engaged the youth in different activities so that there is exposure. I think there is a physician that looks like me, that speaks my language, that is from my culture. There are these community workers that are knocking on my door and we're doing activities together. And I think that engenders a lot of trust, and that engenders a lot of, I think, opportunities for those conversations. And some of our community health centers are bundled with additional programs that are health related, but not, like, we know education is a social determinants of health. Okay, so some of our community health centers bundled with programs, for example, Pathways to Education, that supports the community they are in and their patient base, with also some of those education, mentorship, and training.
Thank you. Appreciate it. I'm going to scroll through to see if there's any hands up. And if not, I'll proceed perhaps to the last question. Okay, I have a question for Sarah. Sarah, I'm not sure if there's a direct translatable explanation or if there's a cultural translation here, but how did you come up with the title "To Do" for your project with regards to translation of documents and such?
No worries. So To Do is actually a project that started almost 10 years ago from Dr. Evelyne Trottier and Dr. Marie-Joëlle Doré-Bergeron, who are also collaborators on this poster, also with a big team of patient partners, advisors, and nurses. The name came, well, first of all, To Do means en douceur, tout en douceur, which means, in English, it sounds a bit weird. Let's say it sounds softly, everything softly. So the name basically just means that we just want to be able to give and provide health care to our children of the country in a very soft way that makes them feel comfortable and have a positive experience in the end.
Okay, thanks for that translation. I guess that equals to being gentle with the delivery of care.
Yeah, gentle.
Yeah.
Every time I go on Google Translate for it, it always says sweet project.
Oh, we could probably come up with 3 more sentences too if we go to Google. Thanks for your interpretation and explaining the reason why.
No worries.
Okay. All right, so just double check here, make sure there isn't anything else. I hope I'm not missing anybody. I should be able to see the icons as I should. If so, just barge in and let me hear your loud voice. I won't take it personally. Okay. All right, so I'll just say I've had a lot of insightful thoughts today, thanks to the presenters. And I want to give a special thanks to Lindsay, Sonia, Sarah, Kelly, Kathy for their time and energy, not just to present, but to prepare. There's a lot of work that goes on behind the scenes. And then additionally, thanking all the guests here from coast to coast to coast, a border for coming and working with our national partners to learn from one another. I'd like you all to remember that a good start with a positive focus on continuous change will outperform the perfectionist in the long run. And I translate that to being that the imperfect will always rise above. So stay committed, stay hopeful, grow your impacts, and thanks for being part of CHC.